Good afternoon, everybody. Welcome. Session is now beginning. I'm Reg Romero. I'm your moderator for this session. Welcome to our Experience VCC virtual open house. Begin with a territory acknowledgement like we do here at VCC. I'd like to begin by acknowledging that we are on the unceded territory of the Coast Salish peoples, the traditional home of the Squamish, Musqueam, and Tsleil-Waututh nations. Today you'll hear about certified dental assisting, dental hygiene, dental reception, and dental technology programs. Each presentation is roughly 2 to 3 minutes. Then we'll have a VCC advisor discuss how we can help you with the application process. There'll be a Q&A that I'll give you a little more instructions on how to do that. And we'll even have a code at the end of the presentation to help you win a $1,000 tuition prize. Okay. Q&A. You're not going to be able to talk to us directly, so you're going to write your questions in the chat. And after all the presentations, I will be reading your questions out loud. Please indicate the program the question is about, and that way the correct presenter can respond. As I mentioned, I will be reading your questions out loud, and because we only have an hour, if we don't get to your questions or you have more questions, there is an advisor drop-in Zoom session until 5 p.m. today, and you'll check in your chat. At the end of the presentation, I will put a Zoom link in there for that session. Okay, so like I mentioned, there are 4 presentations today, and we will begin with a certified dental assisting presented by instructor Michelle Roscoe. Okay, Michelle.
So I'll introduce myself. I hope everybody can hear me. My name is Amber Aris. I'm the current department leader of the Dental Hygiene Diploma program at VCC. Our program has been running and graduating dental hygiene students since 1987, so it's been around for a very long time. It's the most long-standing program in the province, and it is very well respected nationally and internationally. It has always maintained accreditation with the Commission on Dental Accreditation of Canada, which means that our graduates do not have to write a clinical exam. Their clinical competency is determined in the program, and they just write the national written part of the board exam once they complete the program. Dental hygiene diploma programs in Canada are all considered 3-year diploma programs because entrants to the program have already completed a first year of prerequisites of university transfer, English, psychology, biology, chemistry, statistics, and an elective. The final 2 years in the dental hygiene department are at VCC, and they are full-time from September to June for 2 years, Monday to Friday. Only graduates that have completed the diploma program and successfully completed the National Dental Hygiene Certification Board exam can apply for registration with the College of Dental Hygienists of BC and can become active registered dental hygienists. Dental hygiene is a career in a self-regulating profession. It has various and integrated practice opportunities in a number of different healthcare roles that include the majority of dental hygienists work in clinical practice in dental offices, but there's a number of other roles as well in public health, hospitals, community, education, research, and administration. Dental hygienists play an important role as primary oral health care providers that educate individuals and groups in oral health and overall health and wellness. Dental hygienists analyze theory and research to provide evidence-based care and implement public programs to promote access to quality and cost-effective services. The applicants to the dental hygiene program at VCC, the numbers have really been increasing. It is a competitive selection basis annually that is based on a GPA average on your first year prerequisites, as well as the results of the candidates questionnaire, which is a series of 5 questions that evaluates your suitability and aptitude for the dental hygiene profession. And our program offers up to 22 seats annually. If you wanted to hear a little bit more information, our next info session that's dedicated to dental hygiene. They run about an hour long each, and we generally offer them monthly, other than when Experience VCC is running. And our next one is scheduled for November 18th, and you can register for it online at the VCC site.
Thank you, Amber. We're going to try to go back to Michelle and see if it works, because Michelle actually takes care of 2 of our programs today. Yeah, we're all good. So let's start with certified dental assisting.
Okay, thank you very much. Technology is working for me now. Well, again, good afternoon. I'm Michelle Roscoe, and I'm speaking to you today about our 2 programs. We'll start with certified dental assisting, and then we'll talk about the dental reception program. So the certified dental assisting program is also an accredited program. It is accredited by the same body that accredits the dental hygiene program, which is the Commission on Dental Accreditation. And as Amber has said, our programs have been accredited since they started at VCC, and the CDA program is older than 40 years. So it's the longest running program in the province and one of the longest running programs in Canada. Very well respected. If you're a VCC grad, everyone knows that you've been very well educated and you're very, very ready and prepared to enter your profession and career as a certified dental assistant. The accreditation allows you to graduate from the program. You do have to complete a national written exam, but it does exempt you from the clinical exam because we are accredited. We're a 10-month long program, usually starting in September and graduating our students in June, and taking somewhere between 75 and 85 students each fall. Our program is a hybrid, really, of the theory and clinical components that come together to allow you to practice as a certified dental assistant. In some roles, you're working as the operator, where you are actually providing direct services for the patient. So an example might be polishing their teeth or giving them fluoride. Or you're working in an assistant capacity where you're working across from the dentist, and you and the dentist are providing care for that patient. For example, the patient is receiving a filling and the dentist is preparing the tooth and the assistant is assisting the dentist for that procedure. So there are 2 very distinct roles for certified dental assistants. Once you graduate from the program, there are opportunities to specialize, and the opportunities that are available in our province is the orthodontic module, where you would be educated to do some specialized skills in the area of orthodontics, which is braces. There's also a prosthodontic module, where you would receive specialized education to work with dentists and patients who are receiving crowns on their teeth. And lastly, there is a sedation module, where if you were working in a practice where patients were receiving sedation to help them feel more comfortable, more relaxed with their treatment, there is a sedation module that provides you with extra education and extra skills that you can perform in that area. Lots and lots of jobs. No problem with finding work after you've graduated, and certainly with the VCC certificate, there's absolutely no problem with that. Most of our graduates find work in general practice when they graduate, but certainly there are opportunities in all of the specialties in public health as well. And people are in the career for a long time generally, and find it a very rewarding profession. Okay, so part two, the Dental Reception Coordinator Program. This program prepares you to work in dental reception in the administrative part of the office. So I'm sure that many of you have been to a dental office, and the first smiling face that you see, or the first person that you speak to when you might phone the office or text or email, is the dental receptionist. They have a very important role in the office because they are that first contact for the patient. They are ultimately responsible for all of the scheduling of patients. So patients who are coming in as new patients, patients that are returning for treatment, patients who are coming in for their 6-month or 1-year checkup. So the receptionist is very, very involved in the scheduling day-to-day for all of the staff that are in the office, the dentist, the dental hygienists, the certified dental assistants if they're providing direct care. So that's a very, very major part of their work. And I would say almost all offices are doing this on using dental software. So using some sort of electronic system for scheduling all of their patients. The other part that is equally important for the dental receptionist is learning and being knowledgeable about dental insurance because it has to be processed properly and correctly in order for the dentist to be paid for the work. And there are many different insurance companies, and they have their various forms that have to be filled out with using the dental language that you will come to know and understand and use very fluently. So those are the two very major parts of the job and major parts of the education that you receive from us. In addition to that, in the province of British Columbia, a dental receptionist who has the radiography module can expose x-rays on patients. So part of the program is the dental radiography course. And when you graduate from our program at VCC, you can also receive your certificate from the College of Dental Surgeons of BC that would allow you to take x-rays on patients as delegated by your dentist employer. So that's an extra credential that you would graduate with from our program. This program has 2 intakes a year. It's a 5-month program. So we start a program on a cohort in the fall, and we follow that with another one in January or February-ish. And it is a 5-month program. It's not a licensed profession, so unlike dental hygiene or certified dental assisting, you do not have to be licensed to perform these duties, but certainly dentists are looking for formally educated receptionists that can hit the ground running in their role in the dental office. And we take about 20 students in each of those cohorts. Thank you.
Well, thank you, Michelle. Up next is dental technology, presented by Department Leader Ken Zumi.
So I'd just like to introduce myself. My name is Ken Zumi. I'm the department leader for the dental technology program at down here at VCC, downtown campus, and our program's been here for a long time too. We're kind of looking back at the history, probably back in the 80s, no, earlier than that. But just recently, as recent as January 2017, our program went under a major revision, and it went from a 2-year program to a 2.5-year program. So that 5th semester is actually a 15-week external practicum, and we put you in laboratories, and you will, have that work experience in the different disciplines that in dental technology, and that really helps the graduating students with employment opportunities. A lot of employers, it gives them an opportunity to try it out, and it's been quite successful. We have an intake every September now. So every year, it used to be every other year, but since January, it's been an intake in September every year. We take 16 students per cohort. Currently, we have 3 cohorts. One just started in September. We have one midpoint, and one they are out in practicum right now, working in the laboratories. So when you graduate from our program, you receive a diploma in dental technology, and you'll be eligible to challenge the national licensing examination. So in order to be able to challenge those exams, you are required to have gone through some kind of recognized program. It could be out of the country also. The college has a list of programs that are eligible internationally and also across Canada. So, the other thing I'd like to talk about is, as a student, what you would expect to learn in our program. And so you learn as you can imagine in our field, you learn very specialized knowledge and skills. And more we do embed in the attitudes, that are part of the scope of the practice of dental technology. So we do learn the theory aspects as well as the technical, but just as important is the critical thinking skills, especially now with digitization, with all the equipment that we have now, and dental technicians now are really more and more relied upon as consultants. What type of materials do we use? What type of restorations would be, good in certain situation, longevity. There's all these different aspects of our profession now, rather than, decades ago, we just made the products and in the background, but more and more now we are part of that dental team, and required to consult a lot with the doctor, and also with the dentist, and also with the patient. So you'll learn these theory and technical and critical thinking skills to design and fabricate. And there's traditionally and digitally. So we find when you do need to understand the traditional, hands-on aspect of our field, which has always attracted people to our profession. And the digital part is just it's another tool to design and fabricate the products that we're producing. So you learn digitally and traditionally to do complete dentures, removable partial dentures. I have some samples here. Probably can't see it in the camera, but also crowns and bridges, which many of you are aware of. The ceramic work, the all ceramic crowns, orthodontic appliances, these retainers. Probably many of you been to the orthodontist and had to wear retainers. And then the other thing discipline that we teach is dental implants. It's just one of the products we use, samples we use for teaching dental implants. And so we do teach the whole, the whole series of disciplines that are in the scope of practice for the dental technician, and prepare you for entry level, prepare you for the national exam, and prepare you to get out there and start your career. We've been pretty successful with each of the cohorts. We've all been able to secure employment after they graduated, so we're very happy with that. There's a couple of strengths of our program that I'd like to put forward. And one is our program is heavily hands-on, project-based, so you have a lot of hands-on experience. The other, I'm proud of our instructors. Almost all our instructors have been or are lab owners and have been in industry. So they're very aware of the current situation, current environment in our profession. Because as you can imagine, it's been changing so quickly with all the digital aspects. I think that one of the biggest strengths in our program is that we're fully equipped digitally. So we have 3D printers, 3D milling machine. We just got a brand new 3D scanner. So, and with the dedicated computer room that we have for all these digital applications, it'll prepare you really well for your entry into the profession when you graduate from our program. So, I'd like you to consider our dental technology program, diploma program, and visit our website, VCC website, for more detailed information, or you can contact our department directly by email. Thank you for your time.
Thanks, Ken. Next will be our academic advisor. Raj Kapoor will help answer some of your application questions.
Thank you, Reg. So my name is Rajesh Kapoor, and I am an advisor at Vancouver Community College. We are a group of 6 advisors, and we are here to help you. We can assist you with resources available at the college to help make your educational journey a successful one. We will help you map out your educational plans and help you find the quickest way to meet the requirements so that you can enter into your dream career as soon as possible. If you have a question and don't know who to ask us, ask an advisor. You can get in touch with us by calling us at 604-871-7000 option 2. We will be putting that number out on our chats too. And you can make an appointment to either contact us. We will contact you if you make an appointment, either over the phone or by Zoom. And we are there to help you get into the program of your choice. So I will leave the nuts and bolts of the programs to the department leaders who are there on the screen, and they will answer all your questions about the program itself. But in terms of how to get into the program, feel free to get in touch with us after the session. And if you have questions, I will be answering your questions on the chat function. Thank you. Over to you, Reg.
Thanks, Raj. Hey, this is the time we do the questions from chat. There's quite a few, and there's quite a few specific ones. I know that Raj has actually been in it responding as many times as he could. So I think I will still read out the ones that he's responded to. Are you okay with that, Raj?
Maybe we call it out, because some people, if they've joined later, they won't get the answers. So if we just read out the answers, it might be a good idea, Reg.
Okay. So initially, we seem to have a lot of questions about prerequisites. And Raj, feel free to come in at any time here. One of the questions was, do all the courses, for example, in this dental hygiene program, need to be fulfilled if you're already a certified dental assistant in BC? So I guess that's a question for Amber or maybe even you, Raj.
Sure, I can take a stab at that, and Raj can add in. Yes, the prerequisite courses, your first year university transfer courses, do need to be completed before you can register, before you can apply for the remaining 2 years of the dental hygiene program. The completion of a CDA program is not equivalent to first year university, and it is part of the competencies across Canada that the full 3 years need to be completed for a dental hygiene diploma. As far as having completed the CDA program, though, there are some opportunities for prior learning recognition within the program on some specific competencies that do overlap between the CDA scope of practice and dental hygiene scope of practice.
Okay. This is a similar question. Again, I think Amber, you could answer this one on behalf of your program. How far in advance does human anatomy and physiology need to be completed before applying?
So application for next fall is opened already. It's been open since June. Your final courses have to be in progress as of January 2021, and they have to be completed by April, I believe by around April, with final transcripts in for May. I thought maybe there was a bit of a different angle to that question, though, just around how early or how distant you want your anatomy information to be. We do expect that you are coming into the program with some current relevant understanding of anatomy and physiology, because when we begin the anatomy and physiology related to oral health right away in your first semester, it is just building on that previous knowledge.
There's a question here about how do you deliver the courses during the pandemic? Online by Zoom? How about the clinical practice? So I think this is one for all of you probably to take a chance at answering, because I think it might be a little bit different with each one. Who wants to start first? Okay, Michelle. We'll start with Michelle.
For our, and this is of course evolving, so I'll speak to how we are managing the pandemic with our cohorts, our 2 reception cohorts and our certified dental assisting cohort for this fall, but of course this certainly could change. So our students in the certified dental assisting program have what I'll call a hybrid model. So the theory, for the most part, is delivered via Zoom. So the students are in their own homes and they are receiving their theory information by Zoom. And we have a platform called Moodle where we post all of our PowerPoints, our worksheets, our assignments, those sorts of things. And then the students are coming on site to the clinic that the dental programs work out of, and they're receiving their clinical education on site. Our reception students are doing more Zooming than our CDA students. We've been able to provide even the software by Zoom, but they are coming on site for the radiography component because, as I mentioned earlier, they learn to take x-rays, and the only way to learn that is to come into the dental clinic. Previous to COVID, our programs were 100% on site. What the future holds for our programs remains to be seen, whether or not we will incorporate more Zoom even after the pandemic has left us, or whether we will go back to 100% on site. Those questions I can't answer, but that's how we've managed it this year.
Okay, who would like to go next?
I can give it a shot.
Oh.
Oh, you want?
Go ahead,
Amber. Okay, I'll give it a shot.
Oh, sorry, I'm putting Amber on.
Okay.
Sorry, Ken.
Okay, so very similar to Michelle's CDA and dental reception programs, we use the Moodle platform, and so we have actually been doing a fair amount of online learning and some blended components to our program for a number of years already. Our transition during the pandemic has included putting everything that is theory-based, project work-based as much as possible into a virtual format, and we've used a variety of different mechanisms for that. It has included Zoom, it has included the Moodle platform, it has included some online learning, it has included a variety of sort of student-driven ideas around how they can present projects and presentations and deliver them to faculty in a unique way. So there have been a lot of ongoing innovations. We have kept our clinical portion of the program very strong, although it's being delivered a little bit differently as far as the timeline. Right now, what we are finding is working well and really follows a good protocol as far as what's happening in the world with COVID. We have students on site for 2 to 3 full days, completing sort of a clinical intensive portion of the program, and then off-site for about 10 days, doing, preclinical support work, learning theory, project-based work in a variety of different formats.
Okay, Ken, you're next. Thanks.
Okay, thanks, Reg. So we're very similar. Any theory-based courses are being done online, and for us, we really wanted to get our students on to campus as much as possible. But because of our small cohort size, we were able to social distance and align our the room use during the week. But they're off campus each cohort about a day and a half, and so 3.5 to 4 days they can be on campus doing their hands-on type work, because it's a lot of equipment that's required to get through our program, and you can be aware that you just can't have this equipment at home, and safety-wise, and also just the logistics of having that type of specialized equipment at home. You can see behind me, there's one cohort. They're in there and they have to wear their masks, and we try to create a kind of a bubble within each of the cohorts so that they're not roaming around. And we do have a dedicated area for their lunch and rest area. VCC has a daily COVID questionnaire that goes out to the students before they're out onto campus anyway. So I think so far, touch wood, we've been pretty fortunate. Students have been very cooperative, as well as faculty. And that whole dental department up here on the 3rd floor has been working quite well amongst everybody. So yeah, I feel moving forward, we will probably continue this type of format, and maybe we can get some more technical things online. But when we were off campus in March up until end of May, it was extremely difficult for us to teach the technical aspects online. So we find it necessary to be on campus as much as possible. Thanks.
Okay, thanks, Ken. There's a question here for Amber. I have heard that in 2019, there was talk of making the dental hygiene programs into a 4-year degree. Do you see this transition occurring anytime soon?
It is a project that we're still working on at VCC that we're trying to move forward. As far as dental hygiene, really across Canada, our national association and even the provincial regulators are really leading leading a movement to make degree as entry to practice something that is considered across the country. We aren't quite there yet, but I do see movement in that direction. And from VCC's perspective, we do want to be on the front end of that, and we are working with government to see about a proposal. I did notice a question there, just kind of leading off that, about opportunities to complete degrees. We do have articulation agreements, and students from the diploma program at VCC can take a block transfer of their diploma credits and complete a degree at UBC. There's also options to complete a dental hygiene degree at the University of Alberta. And there's other opportunities to complete degrees in various other areas. A couple of the common ones are at Thompson Rivers University, where you can complete a Bachelor of Health Science degree online, or a Bachelor of Arts degree. So there's a number of different opportunities to complete a degree just by completing that final year at a number of different institutions. But we are hoping to be able to keep people at VC for the full 4 years in the near future.
A couple more questions similar for you, Amber, and it's related to GPAs. And it's somebody here is looking to apply for dental hygiene 2021, working on prerequisites. What GPA should I aim for?
That's, as Raj will, I'm sure, agree with me, that's an unpredictable question to answer. It really does vary from year to year. So there have been years where, you know, maybe a B+ average has been sufficient. Last year, our most recent cohort that we accepted, the average GPA of those candidates who finally received a seat was somewhere in the neighborhood of about 3.8. So it can really vary even on a year-to-year basis, and our selection is based year to year on the applicants that apply.
And here's a similar question. Is that, I'm guessing, after the program, what is the success for passing the final exam to become a registered dental hygienist? Very
high. Quite close to, I would say, 100% over the years of the program. It's very unusual that someone would be unsuccessful. So our candidates are very well prepared, and when we see the results, we do get results back from the exam based on schools, and it shows that VCC students perform very well, generally higher than average in all areas.
All right. I think this is a question for Michelle. I've been a CDA for almost 9 years and looking to go back to hygiene. Courses such as community practice radiology are required during the course. Do any of the courses from my assisting program transfer to this program? So maybe this is actually a question for Amber. It looks like somebody's trying to get out of CDA to become a hygienist.
So there aren't any full courses from the CDA program that would transfer, but as I mentioned before, there are certain aspects and components within those courses that you might get prior learning recognition for. Some of them specifically are related to things like polishing, application of fluoride, radiology concepts, creating a mouth guard, things like that that do cross over between the education in the Certified Dental Assisting program and the Dental Hygiene program. You can get some prior learning recognition, which frees up a little bit of your time in the program.
Right. There's a few prerequisite questions here that Raj answered, and I think I'll just kind of read them out and allow you to kind of respond to them. One is, how important is your English 12 mark to get into the CDA program? If I'm 1% away from a B grade, should I retake the course? I responded to it, but feel free to let everybody know how you responded.
Sorry, Reg, is it for me?
Yeah, it was for you. Okay. Yeah, your response online was you'll need a 72% or higher mark in English 12. But the question the person had, was it really interesting, should they retake the course if they're a percent away from a B grade? What was your take on that?
Well, it depends on the mark. If you've done your high school graduation through in BC, 73% is considered as a B. But if you have 72% at VCC, the grading is, VCC has its own grading policy. And if you have 72%, we will accept that. So what I would suggest is that you apply to the program and have the registrar's office look at your transcript. I'm thinking that if you're 1 mark away, there is a good chance that you will get in.
Okay, I'll give you this next question too. From Nicole, during the drop position, I was advised that I will be able to apply for the program with the application fee waived. Do you explain what the process is for this?
So Nicole, you would apply to the program, if possible today, through educationplannerbc.ca. And when the system asks you for a payment, you're going to provide this code, which is info 1020. So instead of the payment, you're going to use the code info 1020, all caps.
Let's see. I think we're almost down to our final questions here. And we'll get to them. Okay, maybe again, this is from Nicole, and maybe Raj, something you can answer, because I don't know what this is. I took some IB courses during high school, but not sure if they're eligible to be used as prerequisite. I also don't have the syllabus from high school. Would you please help? So anybody in that kind of situation, what should they do?
Yes, definitely the IB courses can be used towards the prerequisites. I would recommend that you apply today and send in your transcripts to the registrar's office.
All right, and maybe I'll run this one also past you, Raj. Oh, actually, you'd answer it. Can you apply for the hygiene program? You're still enrolled in some of the prerequisites, and you answered yes. You offer the chemistry and human anatomy and physiology prerequisite courses at VCC. Do you offer the chemistry and human anatomy and physiology prerequisite courses at VCC?
Yes, we do offer all prerequisites that are required for dental hygiene at VCC. These prerequisites courses are offered 3 times every year, January, May, and then September. The next term that we'll be offering these courses would be in January, and registration for those UT courses is starting on the 15th of October coming up.
Yeah. Now I'll answer this one for Nicole. The code is info 1020, but it's all caps for info, right, Raj?
Yes, thank you.
Yeah. That's a question here, I think, for Amber. For the DH program, are there breaks during the summer and at Christmas? During the 2 years, are there other breaks between semesters? Monday to Friday, 9 to 4, is this correct? What are the days and hours? And yes, it is located in the downtown campus. So a lot of questions there.
All right. We do give you some breaks, a little break here and there. It's the program is split into 2 semesters per year. So we have a semester that runs from September to December, and then there's usually about a 2-week break before the next semester starts in January, and the second semester runs from January to June, to early to mid-June, with a reading break around mid-March. That's just 1 week long. And the hours are, it is generally Monday to Friday, 9 to 4. That's when the program runs. There are occasionally times where sessions might run into the evening or be on a Saturday, depending on what the needs are with the use of the dental clinic that we do share with other departments. And currently, right now, with a lot of the learning being done online and virtually, some of it is synchronous and some of it is asynchronous. So it does provide a little bit more flexibility. Into that as well, other than the official breaks where you are off on your own time, there is a lot of project work time that's built into the programming as well. So there is a little bit of flexibility in the schedule for everyone to be able to manage the workload. But I will add to that as well that it is a very intense program, and it would be difficult to be planning on working while completing this program, or that's what most past students have told us.
All right. Raj, I'm going to put you on the spot again. It seems like we're getting more and more questions around the application process and prerequisites, if you're okay.
Yes.
So for dental assistant, I did high school in Mexico. Going to translate this. Can the anatomy course be accepted, or do I have to take a new course of anatomy here?
It all depends as to what kind of anatomy course you took. So I would recommend that you apply to the program. Most of the time, the sciences and math from overseas is accepted. So I would suggest that you apply to the program. It does not cost you anything. You're using the info 1020 code and you're applying for free. And then you can send in your transcripts to the registrar's office at an email address that I'm going to put on the web, on the chat function right now. It is ro@vcc.ca. So to answer your question in short, yes, most probably your anatomy from Mexico will be accepted.
Normally, how long does it take, this is from Yan, normally how long does it take to process our application? When will we know if we will be enrolled?
It takes about a week to process an application, and you're able to check whether your application has been approved or not by going on to your account on the VCC website. However, seats for next September are only sent out around and after February. So whether you will get in for next year or not, you will have to wait. But at this time, if you are applying and meeting all the prerequisites, there is an excellent chance that you will get into the program.
Okay. This is a little bit unusual question. Is a Duolingo total 110 score acceptable for dental assistant? I don't have a local education. Is the overseas diploma needed to evaluate the credential?
Yes, I will answer that. Due to COVID, we don't have our internal assessment happening, so we are able to accept a Duolingo English test score of 110 for getting into the dental assisting program.
Here's a question directly to you, I think. Would you recommend meeting with an academic advisor with my transcripts of 4 years university prior to enrolling into prerequisites required for the dental hygiene program?
Yes, because we might be able to identify some university transfer courses that you have already taken. As a starting step, I would suggest that you go to the BC Transfer Guide and see which courses are transferable. And if you see that certain courses at a first year or higher level are not transferable, please do get in touch with an advisor and we can go through your transcript and help you determine as to where the missing gaps are.
All right. I think there are some more specific questions here. Again, this is from Nicole. I guess I'm going to run this one past you, Raj. If I restart the prerequisite programs in January and successfully finish the courses, would I still be able to apply for September 2021 programs?
Can you repeat the question again, Reg?
Somebody's starting the prerequisites in January and they successfully finish. I'm guessing, is there enough time to still apply for September 2021?
There are 10 courses that you need for getting into dental hygiene, and students ideally take 3 courses every term. So if you're going to start in January, the chances of you for making it for the fall 2021, not the best, because 10 courses, I believe, cannot be completed in 4 months. Amber, any addition to that?
Saying it takes at least a couple of years to get through all the prerequisites?
1 year.
1 year?
I would agree with that.
Thank you. And
All right.
remember the fact that you're aiming for a very high GPA. So if you can space out those courses, taking 3 in one term, 3 in another, and maybe 4 in the last term, that will help you maintain a higher GPA, and that is going to increase your chances of getting into the program rather than compressing all, say, 5 courses in one term. That has been our experience in the past.
That's probably why it's good to meet with an advisor to figure out how to pace yourself through this.
Very true.
Yeah. I got a couple more questions that came in, and for everybody else on the chat, you will see that I have put in a couple of links. One is the Zoom advising session that I guess runs for till 5 p.m. I believe. That's where you can talk to VCC advisor. I've also, since we're getting quite a bit of international sounding interest, I'm not sure if these people our participants are here or they're overseas, but we do have an international education Zoom session as well, and I put the link there as well. You can talk to some of the team there, and help give you some advice on how to apply and how to, manage international education with VCC. I only have a couple more. Oh, I have one more here. It's like Raj is up. Let's see. I think these are very similar, maybe to been answered before about if you're taking courses now, can you apply? So here's a specific. Can I only apply to the program while my last prerequisite course is in progress? For example, I just have to take one more chemistry course in the winter. Can I still apply sometime next month?
I wouldn't wait till next month. I would apply today.
Okay. So then that's similar here. Can I apply to CDA today while finishing up a course upgrade?
Yes, certainly you should. And the incentive is that there is a code whereby you can save $35. So do it today.
Don't know who can answer this next question, because all of them. Could you please explain what it means by including, in quotes, including lab under the prerequisite list? Does it mean that if my course does not include the lab, but just the lectures, it can't be used as a prerequisite? Anybody have thoughts on that question?
I'll let Amber answer that.
Sure. Yes, there is a difference in a chemistry course that does have labs. They tend to be more chemistry and biology. They tend to be more likely to be 4 or 5 credit courses, not 3 credit courses. So you do want to, and again, a great opportunity to check in with advising that the course that you're looking at does transfer to the course that is required as one of the prerequisites.
Perfect. Well, I think we're going to wrap up. So I just have a few more slides to show you. This is kind of what we offer at VCC for students to help them with the process and getting settled in. A lot of this is available on our website. Here's your next steps as a student. Or participant, attend an information session. Again, on our website, we do have a dedicated area that shows when our upcoming info sessions are. Meet with somebody like Raj, very helpful in helping plan your next steps. And of course, we're talking about applying and taking advantage of that fee waiver, application fee waiver today. So, and there's that information again, apply the fee. There's the promo code. I think we put it in the chat, but you can take a little photo of this to help you. And all right. If you don't have any other questions, that's the end of our session. Hope you enjoyed it and hope you apply. Have a great day. Thank you.
Thank you very much.